What does an ovarian cyst feel like when it is rupturing, and what should you do? Welcome back to the FemHealth channel, a medical education channel by doctors for you. When an ovarian cyst bursts, the outer wall of the cyst breaks and releases fluid and sometimes blood into the belly. A cyst can rupture during physical activity, sex, or trauma, but sometimes it just happens for no clear reason. The most common symptom is sudden, sharp pain on one side of the lower belly. It can be pretty severe. Some people also feel nauseous or even faint. In more serious cases, there can be signs of internal bleeding like fast heartbeat, low blood pressure, or dizziness. Ovarian cysts are fairly common. In women under 40, about 4 to 7% have cysts found by ultrasound. After menopause, cysts are seen in about 13 to 14% of women. Most ovarian cysts do not cause any problems or pain. If a doctor sees a cyst on ultrasound and the patient has no pain, there is nothing to do. But when a cyst does rupture, it's important to know what to look for and what to do. The pain from an ovarian cyst rupturing can be very strong and might come with other signs of irritation inside the abdomen, especially if there's a lot of internal bleeding or leakage of cyst fluid, which can irritate the lining of the stomach. Sometimes the pain can even be felt in the shoulder if bleeding irritates the diaphragm. Other common symptoms include feeling sick to your stomach, vomiting, or a swollen belly. If there's a lot of internal bleeding, a person might have a fast heart rate, low blood pressure, feel dizzy, or even faint. These are signs that the body is not getting enough blood and need urgent medical attention. Ruptured ovarian cysts can cause sudden and serious pelvic pain and may lead to internal bleeding. On physical exam, doctors might find that pressing on the belly causes more pain when they let go, or that the muscles in the area are tightening up to protect the area. Lab tests may show signs of inflammation or infection. What should be done if you suspect a ruptured ovarian cyst? Doctors usually diagnose a ruptured cyst with an ultrasound. An ultrasound can show fluid in the pelvis or signs that a cyst has collapsed. In more complex cases, a CT scan might be used. Blood tests may be done to rule out more serious issues. It's important to make sure the pain isn't caused by something else like an ectopic pregnancy, ovarian torsion, or appendicitis. A pregnancy test is also done to make sure the patient's pain is not related to a pregnancy. How are ruptured ovarian cysts treated? If the person is stable and not bleeding heavily, treatment is resting, taking pain medication, and being closely monitored. But if the pain is severe, the bleeding continues, or there are signs of something more serious, surgery might be needed. Laparoscopy is usually preferred, but sometimes a bigger surgery is required. The good news is most women recover without needing surgery. But for women who keep getting these cysts, birth control pills may help prevent future problems. Remember to seek medical care as soon as possible if you are having pain or other concerning symptoms.